I want to insist that fertility is a great good. Fertility is a great good. I now give talks about why green sex is best. I did it recently in Boulder, Colorado. I kept addressing the audience as my green friends. And it made some sense. They were very uncomfortable because they saw the logic that we don't think we ought to put chemicals in our food and in our air and in our water. So why are we putting these hormones in our body day after day, month after month, year after year to deal with something that's a very healthy condition? It's healthy for an adult woman to be fertile. A woman who's infertile is actually in an unhealthy condition. She's the one that needs medical care to restore her to her natural condition. I also think that contraception basically is an insult to women. It's treating a woman's body as though it were defective, right? That there's something wrong with the fertility cycle that we have. And we, through medicine, what's medical about contraceptive? Again, a fertile woman is a healthy woman. This woman saying, I'm sorry, when I have sex, I may get pregnant. Sure, I'll be glad to mess with my body to correct this humiliating and inconvenient feature of my sex. So I think it's an anti-woman act to prescribe any one of the chemical contraceptives. Spent at least $68.7 million to settle hundreds of lawsuits filed by women who suffered blood clots, heart attacks, or strokes after using the company's ortho-evro birth control patch, court records show. Johnson & Johnson, the world's largest maker of healthcare products, avoided trials through the confidential settlements and hasn't released the financial details to investors. These were young women, 30-some, I think I got the next one, I don't. There were 500 some women, something about 30 of them died, right? They were young, in their 20s. And they died of heart attacks and strokes, which, is not a usual cause of death for a woman in her 20s. But the patch evidently is very, helps women die from those causes. Contraception and breast cancer. I recommend this article. The Journal of the Mayo Clinic has published a key article in its October 2006 issue entitled Oral Contraceptive Use as a Risk Factor for Premenopausal Breast Cancer, a meta-analysis authored by Chris Kalenburn et al. I can't go into all of this. We're going to have to skip this. Chlamydia, the largest number of cases reported to date were last year, right? Yet the majority of infections are still undiagnosed. Right? So more chlamydia last year than ever of any disease ever reported in the United States was last year. What are undiagnosed consequences of undiagnosed chlamydia? Infertility, ectopic pregnancy, and chronic pelvic pain that comes from the pelvic inflammatory disease that often comes with chlamydia. This is what the Center for Disease Control says. Go to their chlamydia website. It says, the most reliable ways to avoid infection with an STD are to abstain from sex, oral, vaginal, or anal sex. This is the Center for Disease Control. Or to be in a long-term, mutually monogamous relationship with an uninfected partner. And the best way to do that is to be married, all right? So this is the Center for Disease Control finally getting sane, all right? We all know this. If you want to be free from disease, sexually transmitted diseases, don't have sex before marriage, right? Get married. Out of wedlock births, last year 40% of the babies born in the United States last year were born to single mothers, right? Well over 50% of the women going to abortion clinics say that they were using abortion clinics. 83% of the women are unmarried. Well over 50% say they were using a contraceptive at the time that they got pregnant. Divorce rates have skyrocketed since contraception became available. In 1960, 9 out of 1,000 women were divorced. By the year 1980, 23 women out of 1,000 had been divorced. Test tube babies, you all know about this. Huge increase of infertility in the United States. Huge increase. Why? Because of sexually transmitted infections and scar tissue, fallopian tubes, and uterus, etc. Contraception bad consequences. Bad for the health of women. It facilitates sex outside of marriage. It facilitates bad relationships. It increases the incidence of sexually transmitted disease. Leads to unwanted pregnancy, single parenthood. Causes and leads to abortion. Contributes to divorce. And contributes to social chaos. 40% of the babies last year born in the United States were born to a single mother. I teach in Detroit. 75% of the babies born in Detroit are born to a single mother. 75%. Detroit, I think we probably vie with Baltimore, but I think we beat Baltimore for joblessness, right? For crime, for drug addiction, right? Tell me there's not a connection between 75% of babies born out of wedlock and all of these problems. There's no tax base in Detroit, virtually none. Very hard to have any decent schools, decent police system, roads, anything, healthcare. Right? Again, if I could stop people doing one thing on the face of the earth to make everything better, it would be to stop fornicating. Right? Stop having sex before marriage. If we stop that, can you imagine what would change in this world? The single biggest cause of poverty in the United States, or the largest number of people living in poverty in the United States, are single women with children. Now, how did that happen? Right? Why are they single with children? Explain it to me. Right? Pharmacists and Conscience, doctors and conscience, you know now that the government is threatening to tell us that Catholics that we're going to have to do abortions, we're going to have to give out contraceptives, we're going to do all sorts of things we don't think are right. I had a debate recently with a lady lawyer who was telling me, she said, a pharmacist should not let his or her personal preferences stand in the way of health care for patients. Right? That's what she said. A pharmacist should not let his or her personal preferences stand in the way of health care for patients. And I said, I'm sorry, I have to challenge that statement. I say, first of all, we're not talking about preferences, but about deeply held moral convictions. And our culture doesn't know the difference. It doesn't know what a deeply held moral conviction is. You think abortion's okay, I think it's not okay, you like chocolate ice cream, I like vanilla. Who's to say? It's all the same. You say, I won't do anything, I don't want to kill unborn babies. I say, well, I understand you've got that preference. All right, but my preference is that I should be allowed to have an abortion if I want one. But this is night and day. This is night and day. This is saying, I want slaves, you don't want slaves. Right? I want to kill Jews, you don't want to kill Jews. To our culture, it's just a matter of opinion. Right? And not saying, sorry, I won't do it. I would die rather than do it. What do you mean you would die rather than do it? It's just a preference. Chocolate ice cream, vanilla ice cream, no big deal. Right? So the categories didn't seem to register when I was telling her, just for pharmacists to say, I'm not going to give out an abortifacient contraceptive, emergency after pill. I'm not going to do it because I think that I could be helping cause the killing of an innocent human being. I'm not going to do it. We say, oh, you're denying a woman health care. I said, excuse me. Again, contraceptives aren't health care. It's not health care. Right? We're talking about facilitating people's lifestyle choices. Right? I'm not denying her any health. I won't deny her health care. I'll give her anything she needs to improve her health. But this is not a health care question. And she couldn't tell the difference. Well, doctors prescribe contraceptives, therefore health care. The contraceptives are health care. I said, oh, well, Margaret Sanger got to you. Margaret Sanger did a brilliant thing. I mean, contraceptives, sometimes I think contraceptives, we should make them over the counter, every single one of them, right? And put them over in the porn section of the drugstore, right? Put them where they belong, right? It's not something a doctor should be handing out, right? Now, we do it because they're bad for people. And so we're not going to give it to you because it might make you sick. So I've got to make certain that I can monitor your taking this because it's bad for you. So I'm going to monitor your taking I'm going to prescribe something for you to make your body sicker, and I'm going to monitor that. So that's why a doctor has to do it. That's the fact of what's going on here. We're not giving something that makes women healthier. We're giving them something that makes them sicker or not so healthy, and that's why we're monitoring it. I said, I can see why you're doing that for chemotherapy, because chemotherapy fights cancer. I said, you got to monitor that. Why are we monitoring your contraceptives? Why are we giving them if we're monitoring them? Because it's not, there's all sorts of health risks in taking contraceptives. That's why we have to have a doctor do it. I say, but it's not necessary. So why are we doing it? All right.